Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider. Varicose veins and surgery. Introduction. Varicose veins are very common in both women and men. Varicose veins can be painful and unattractive. Vein doctors use non-invasive ultrasound imaging to find the source of the varicose veins. It is essential that the veins not visible on the skin's surface are evaluated. Commonly, a deeper vein called the saphenous vein is not working properly, causing the discomfort in varicose veins. This vein will also need to be corrected. With ultrasound imaging, doctors may recommend treatment to correct the varicose veins and any underlying sores. If your doctor recommends surgery, the decision whether or not to have the surgery is also yours. This patient education program will help you understand the benefits and risks of current varicose vein treatment options. Anatomy. The heart pumps oxygen-rich blood into a large artery known as the aorta. The aorta divides into two main arteries which continue to branch into smaller arteries delivering blood to the rest of the body. Once the oxygen has been delivered, veins carry the blood back to the heart. Unlike arteries, veins are dependent on one-way valves to keep blood moving in an upward motion. The muscles of the legs help push the blood through the veins. The one-way valves close and prevent the blood from falling back towards the feet. Symptoms and their causes. When the one-way valves fail to close properly, blood can reverse its flow. This causes increased pressure in the veins and over time can cause them to swell and become bulging varicose veins. The increased pressure can lead to significant symptoms such as swelling of the ankles or legs, severe pain and aching, and complaints of tired legs. Skin changes, ulceration, and phlebitis are all possible with long-standing varicose veins. Because the blood is not flowing efficiently, clots can form in the veins causing hard lumps and severe pain. This is known as superficial-phlebitis. This is not the type of clot that doctors worry will travel to your heart, lungs, or brain. It is possible to have varicose veins without pain or swelling, and it is not necessary to have them corrected. If they worsen and become uncomfortable, it is considered medical, and most insurance companies, including Medicare, will cover varicose vein treatment. Healthy valves come together and prevent blood from flowing backwards. Valves that do not come together allow blood to flow backwards and cause the vein to enlarge. Heredity is the primary cause of the development of varicose veins. Pregnancy, obesity, hormonal influences, and environmental factors such as prolonged sitting or standing can also contribute to the development of varicose veins. Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials. Preventive measures. Measures that help the blood flow toward the heart can be helpful in slowing the progression of varicose veins and in minimizing discomfort associated with vein problems. Graduated compression stockings are helpful in getting fluid out of the legs and back up to the heart. Knee-high stockings are not recommended. They should at least cover the thigh. Self-care can help prevent or treat varicose veins. Self-care measures include regular exercise, not sitting or standing for long periods of time, losing weight if you are overweight, not wearing tight clothes, keeping your legs raised up while sitting or lying down. If none of these measures help alleviate the symptoms, treatment may be recommended. Varicose vein treatment. If self-care measures do not relieve the pain, a procedure may help. Healthcare providers can usually fix varicose veins in an office setting without a trip to the hospital. Heat energy from a laser or radiofrequency source may be used to stop blood flow in the affected vein. This may be done using a laser without an incision, or it may be done with the help of a catheter, a small tube inserted into the vein. Sclerotherapy is another option. In this procedure, the healthcare provider injects liquid or foam into the veins to close them. The healthcare provider may perform an ambulatory phlebectomy by numbing the leg and then using tiny needles to treat the vein. After one of these procedures is performed, a compression bandage will be applied to minimize bruising. Walking is encouraged immediately following a procedure. In some cases, patients may need surgery. High ligation and vein stripping involves tying off and removing the vein surgically. In rare cases, the surgeon may use small incisions and a tiny camera to remove the veins. These procedures are usually on an outpatient basis. This means that you will probably go home the same day. After the procedure. After the procedure, you will need to wear compression stockings. You will be able to do light daily activities. When you rest, you should raise your legs. Anti-inflammatory medication and/or pain medication may be given and should be taken as prescribed. Heavy exercise should be avoided for 1 to 2 weeks. Avoid hot tubs, pools, and tub baths for 2 weeks. You will be scheduled for a follow-up appointment to ensure you are healing properly and to use ultrasound to confirm closure of any deeper veins that were treated. Your doctor will also confirm that no blood clots have formed in the deep vein system. Risks and complications. Bruising is common and should resolve on its own in 1 to 2 weeks. Using the compression stockings will help speed up this process. Bleeding is possible. Direct pressure and a compression dressing should be applied. Let the doctor's office know if you have trouble keeping the dressing dry. Some discomfort is normal. Anti-inflammatory medication is provided to help with this side effect. If the pain is so intense that it affects walking or daily activities, talk with your healthcare provider. Infections are rare but possible with any procedure. Increasing redness and tenderness in a particular area should be reported to the doctor's office for evaluation. It is possible that some varicose veins may remain after the procedure, and this is evaluated at the follow-up appointment. These procedures are very safe. There are risks, however, as no procedure is risk-free. Severe complications are extremely rare and unlikely. By being informed, you may be able to help your doctor detect problems early. If you like this video, please like and share. For similar videos, subscribe to our channel. Summary. Veins are dependent on one-way valves to keep blood moving in an upward motion. When the one-way valves fail to close properly, blood can reverse its flow. This causes increased pressure in the veins and over time can cause them to swell and become bulging varicose veins. Varicose veins are very common in both women and men. Self-care can help prevent or treat them. Self-care measures include regular exercise, not sitting or standing for long periods of time, losing weight if you are overweight, not wearing tight clothes, keeping your legs raised up while sitting or lying down. If self-care measures do not relieve the pain, a procedure may help. Healthcare providers can usually fix varicose veins in an office setting without a trip to the hospital. After the procedure, you will need to wear compression stockings. They are helpful in getting fluid out of the legs and back up to the heart. You will be able to do light daily activities after the procedure. When you rest, you should raise your legs. Thank you for using Explain.